Well, good afternoon or good evening, depending on where you are. Thank you for joining us in this virtual special event, which will be devoted to the presentation of the last edition of Atlantic Current. This 2020 edition has been devoted, it may not come as a surprise to our audience, will be devoted to COVID-19 crisis viewed from the global south. And to introduce some of these chapters, I have the privilege to host this webinar with the participation of Mr. Eduardo Amaral Haddad and Mr. Mustafa Izrazi, two eminent senior fellows of the Policy Center of the New South, and Ms. Salma Dawdi, a research assistant. The three have contributed with three different chapters to this edition of Atlantic Current. I will begin by Mr. Eduardo Amaral Haddad, who wrote a chapter on the COVID-19 crisis and geography of discontent in the global south. I would like him to make a very brief presentation of this chapter, and we will, depending on his presentation, we will have one of the questions. You will have 10 minutes, Mr. Haddad.
Thank you, Mr. Loulichki. I'm very pleased to be part of this panel to discuss some of the chapters related to the 2020 Atlantic currents. It's a great pleasure to share this event with my colleagues from the Policy Center for the New South. And what I'm going to try to do in the next few minutes is to give, as requested, a very brief presentation about my contribution to the volume. Actually, as was already mentioned, the title of my chapter, my contribution, was the COVID-19 crisis and the geography of these contents in the global south. So the chapter is structured around this concept of geography of these contents. What does it mean? We'll be looking at the subnational level, so within country, impacts of the pandemics, and according to this, the concept of geography of these contents means that the context in which we live and work heavily shapes how we view the world and how we think about the challenges we face. So if we take a country which is very heterogeneous internally, people will have different views about the world. And of course, it's going to depend on where they live in their respective countries. So the greater the levels of interregional inequality within a country, the greater will be the differences in public perceptions that tend to arise. So in the context of our topic, the COVID-19 pandemics, we see that the spread of the virus, of the coronavirus in the global south, when you look at different countries, it's going to be strongly related to social and spatial structural inequalities that exist in this region. So if we, in different countries, for instance, specific geographies and structural features will absorb the shocks generated by coronavirus in different ways. So my argument in the chapter is that in the global south, given strong within inequalities, there is a higher potential to generate increasing discontentment in regions that are left behind. So it's important for us to understand. In the chapter that I have a more economic focus, so it's important to understand the economic impacts of the pandemic by taking into account not only the sectoral, but also the regional interdependence within countries, so that when you see the impact, you see that they're going to be very different, not across the space, across the sectors, and across different economic agents. So you have informal labor markets will be differently affected if you look at the formal labor markets. You have different segmentation, so public sector versus private sectors, different degrees of impacts across occupations, and of course this is going to reflect the regions, and so that you find workers and firms that are economically more vulnerable than others. So just to conclude, this is going to be very important to the design of mitigation policies, and government must take into account such heterogeneity of the impact. So that's a brief summary of what I saw in the chapter if we could take a lesson from the determinants of regional economic vulnerability in the country, we found, looking at different countries such as Brazil, Colombia, Morocco, Angola, that regional economic vulnerability to the COVID-19 pandemic was positively correlated with the share of informal workers in the region. So in regions within countries with a higher share of informal workers, that's going to be more vulnerable. The level of compliance with restriction measures, and also the adverse impacts in neighboring regions. So that's important. And finally, the greater the share of the public sector in the region's GDP, the lower its vulnerability, since public workers tend to be the least affected by the COVID-19 shocks. And that's, again, it's also going to be a source of regional tension, as the public sector is concentrated in small areas of different countries. So that's about the big picture of my contribution.
Thank you. Thank you, Mr. Haddad. I cannot but try to ask you one question that came to my mind while listening to you. I think that nobody can deny that governments of different countries, regardless of their level of development or the means at their disposal, try to pay attention to this gap that you referred to this feeling of discontent. Do you maintain that despite this effort, despite this shift in the thinking of the government and sometimes even this social net that some countries have decided to provide, and Morocco is one of the medium income countries that made a tremendous effort by creating a fund of about $3.5 billion. Do you maintain that this kind of understanding and this effort of reconciliation between state and society will keep this feeling of content, or this feeling will vanish or diminish?
Yeah, well, that's a very good question. I mean, one of the good things we saw during the pandemic, if we may say so, is that the societies, the civil societies within country, they gave a positive answer to the some of the problems related to the pandemic by actively generating some even financial resource to help those that were more vulnerable. That's one point. Government response were also seen in different parts of the world, right? You mentioned Morocco. We saw different experiences in the let's stay in the global south, that governments had actually made some financial efforts to generate extra resource to try to mitigate some of the problems related to the pandemic. But of course, one of the main challenges for countries in the global south is the lack of resource, not only to contain the spread of the virus, but also to mitigate this, its adverse effects. And in this sense, the social response was very welcome for mitigating part of the effects. So the way I see is that, and I actually discussed that in the chapter, is that of course you have to pay attention to the heterogeneity of the impacts to design mitigation policies. And you have, of course, short-term measures that usually when you look at the different experiences in countries in the global south and even in the north, is that usually government directed resources to investments in the health system, for economic protection to the more vulnerable population groups. We also saw many initiatives to provide subsidized credit to guarantee the survival of firms, and also the maintenance of jobs, and also in looking at the geographical aspects, we also saw in many countries financial support to regional governments in the less developed regions. So this helped somehow to mitigate some of the effects from an economic perspective, and also some from a health perspective, since some of these investments were directed to the health system to mitigate the effects of the pandemic. That's for the short run. We didn't expect the crisis to last so long, and financial resource started to getting more and more scarce. So that's one point. How long governments are going to be able to provide this additional resource to mitigate some of the effects, we still have to wait and see. And the longer the pandemic lasts, I mean, in the context of the chapter, my contribution, I think the stronger the discontentment in some of the regions of countries will increase, especially regions that are more economically vulnerable to the pandemic. How to cope with that in the long run? You have then to go to think more closely on regional development strategies, so that you try to reduce regional inequality within countries. But that's the topic for later. So.
Okay, thank you, Eduardo. Now let me turn to Mustafa Ghazrazi. You decided to tackle the issue of COVID-19 from a very specific and very sensitive angle, that of the anxiety and the behavioral changes. Can you share with us your findings as far as, well, in general, but because you have been also involved in managing the issue with the civil society in Morocco, you might bring for us some good practices. You have the floor, Mustafa.
Thank you, Excellency, and thank you for everybody. Thank you for inviting me to this important meeting to brainstorm what we have published a few months ago. And well, the issue I dealt with is related to the impact of COVID-19 on the mental health, mainly looking at the anxiety, behavior change, cognitive dissonance in such time, difficult time that the community in Morocco and elsewhere have experienced. Basically, in terms of methodology, I choose to work with 4 indicators. The first one is the fact that COVID-19 has 4 or 5 stages, which has different impacts on the population. So the first 3 months with uncertainty, and the strong uncertainty and strong fear, which has generated even death fear. And the second stage is has affected also differently the population, and of course the stage of lockdown, the post-lockdown, and today we are in another type of uncertainty, preparing for how we say getting back if possible, but also uncertainties related to the vaccine issue. The second indicator I have used is looking at different type of communities. So, which means that the impact, of course, was global, as some psychologists from Korea call it Corona Blue. It's like a sky that has shared with us the same feeling of distress, but there is some more weak and vulnerable communities like children, women, people affected by mental disorder before, addicted population, and frontline populations. These are the populations I was looking to. And of course, one more indicator, which I do believe that it was quite original in this paper, that we have distinguished between two impacts: the impact of the fear from the virus itself, but also the impact of the lockdown, which was addressing our social and behavior performance. So these are, in general, I mean, the issues I look at, but some other findings which was very clinical, that we were looking to what we used to call it the tableau clinique of post-traumatic syndrome. And we have found that in this situation we are experiencing, there was some clinical changes in terms of symptoms. So let me say that it's, well, it was my first exercise that I have experienced to write an academic paper, but I found myself as a policy center fellow engaged in some, NGOs activities. So we worked with around 5,000 members of the population and we have tried to cover 6 months of supporting and accompanying. And it was very important for me, as a sample that helped me to bring more fact findings rather than just reflection or theoretical reflection. And I am open if there is any question. Thank you very much.
Thank you, Siftava, for your contribution. And let me turn to let me leave the domestic domain and move to international domain and ask Ms. Salma Daoudi, as a research assistant, to tell us very, very briefly about the health capacities as new power and instrument in international relations. I think all of us witnessed initiative taken in the framework of South-South cooperation, or in the framework of North-South, with or without the contribution or the intermediation of international organizations. But I think we really discovered some good initiatives in terms of the capabilities of very small and emerging powers and small countries. But I leave that to Salma. Please go ahead.
Many thanks, Ambassador, for your introduction. I'm incredibly delighted to be here today and present the chapter which we have co-authored with Akram Zawi and Miriam Woodman on health capacities as new power instruments. The reason we've chosen, first of all, to address this topic was because the COVID-19 pandemic has truly manifested under the form of a substantially destabilizing crisis, both epistemologically and epidemiologically, by testing the strength and resilience of various countries, both small and larger in size, leading us to question the very concept of power and the way in which a health crisis could reshape its distribution by reshuffling the decks, as well as how health in itself might be further integrated in countries' foreign policy. And so the increasing relevance of global health issues and their emergence as globalized security threats, which is obviously reflecting a growing fear from the destabilizing potential of diseases such as HIV, as we've seen in our most recent history, have revolutionized the political status of health and hence its perceived relationship to power, which we have chosen to explore throughout the chapter. And so within this regard, we sort of conceived of health as various forms of political and economic capital, which in conjunction represent the foundation of power and of its projection. So as such, diseases such as COVID-19 have inflicted pernicious damage to national interests and international interests by heavily stressing health systems and undermining national stability and productivity because obviously of the human loss, as well as rising levels of absenteeism and decrease in productivity. And so this, of course, has adversely affected nations' capabilities and growth potential, providing the basis upon which power is usually projected in the international system. And on the other hand, we've also witnessed that health in itself was a significant prerequisite for a country's inclusive and sustainable development. Countries cannot really project power internationally unless they solidify first their domestic means of protecting populations, which requires adequate public health systems, adequate public health policies, and other social safety nets really to protect local populations' health. And so countries possessing the capacity to monitor and control outbreaks are less dependent on foreign health aid and less dependent on the outside more generally, which often comes attached to conditions. Foreign aid usually comes attached to certain conditions that are not always aligned with a country's strategic interests. These countries that are less dependent on foreign aid are also capable of focusing on other areas of strategic interest to consolidate their power. And so what we've seen, and perhaps this is the general finding which our chapter proposes, is that health capacities can both be a source and an expression of power. They're not sufficient to guarantee power, but they're necessary to protect national interests and solidify power, something which we have seen perhaps best illustrated and embodied by the first and initial global scramble for personal protective equipment, PPE. We've seen that countries that have had the means to secure those equipment have sort of managed to best afford those and offer them to their health systems, whereas other countries were not able to do the same thing. And this is a trend that we also see today with the vaccine race, which is imbued with vaccine nationalism and which is sort of highlighting power disparities and imbalances between several countries.
Thank you, Salma. Let me go back to Mustafa because I discriminated against him. I didn't ask him any question. So let me share with him, with Mustafa, this question. We all know that the education was one of the challenges, and some say opportunities in this turmoil of COVID-19. It had some psychological and sociological impact. But I would like you, if possible, to tell us about the impact of COVID-19 on the primary school student. So that's because this is the most vulnerable category of youngsters. And the second one, what Was the contribution of the parents a curse, or was it a blessing in this in the context of COVID-19?
Well, thank you. I definitely thank you, Ambassador, because you touched something very critical today, and we didn't pay attention all over the world, is the fact that media platforms have illustrated a symbol or a photo for the virus. I mean, the coronavirus with colorful topology. We didn't take into consideration how this illustration has affected the cognitive perception of child. And we have made field work on this issue, so we have found that kids were not able to perceive the threat, and they have materialized the threat just because the media has provided, how we say, physical perception, colorful perception of the coronavirus. And it was affected also the behavior of those children to deal, mainly during the first 3 months I'm talking about this part. From the other side, definitely the parents, they were scared, so even they were obsessed sometimes to deal with their children, and this obsession, of course, from health point of view, was very significant and useful to protect children, but psychologically it has created some side effect, let's say, behavior or perversion in the family performance. Of course, the parents are not responsible on that. There is one more factor, is the flow of information. No one was able to control it. By May, we have seen in different countries, even from north or from south, that such concern to turn to school and to see how they can manage the teaching operation or the schooling operation by distance or by providing half teaching on presence, and this has affected children from the lower category, because as you know, in urban space, what we call it the distribution of space in time for lower classes. When there was the lockdown, many families found themselves facing huge about the full number of the family. They should tolerate themselves to live together, and of course the distribution of space, the lack of informatic platforms in the family. So this has created and generated a lot of trouble within families. Of course, cognitively speaking, so many writings that was done in China, in the States, in Europe, and even in some parts of the South are waiting that those 2 or 3 years will definitely impact the psychological development of those children who face this pandemic aged from 5 to 8 years old. So we cannot see that the file is closed. I guess the impact should be coming out in the coming years. This is what professionals in trauma studies used to say, that trauma basically for working community and for children takes at least 18 months to manifest. I hope that I have answered the question briefly. Thank you.
Thank you, Sim Mustafa. Well, I received 1, 2, 3 so far. 1, 2, 3 questions from our audience. The first one. The first one says, most of one of the outcome of this crisis is the necessity of the government to pay more attention and to prioritize the healthcare and the health infrastructures. And the question is, can the developing and the least developing countries afford to do that? Or is it only some kind of gimmicks in order to calm the anguish until we see what will happen after? The second one, somebody raised the issue of in the face of COVID-19, can we say that there is more resilience in rural area compared to the cosmopolitan cities? And the same question goes to say, are there any differences between star cities and small and medium-sized cities? So these are two questions. The third one, and it's up to you to take one or to take the other. The last one is related to the reform of the World Health Organization after this experience and after the criticism. This member of the audience is asking, is it time to renovate and revitalize and reform the WHO management and the way to the rules and the mission of WHO? So it's up to you to volunteer for one or the other, or you can even address the three questions. Let me maybe begin by Selma, if she can say something about the World Health Organization and the necessary reform of this extremely important agency of the United Nations system. Go ahead, Selma.
Yes, thank you very much. And this is indeed a very important question, and one that has been sort of brought at the forefront of the international public debate with the COVID-19 pandemic. I mean, this is not the first time that the WHO has sort of been criticized, and more generally, international organizations, including the WHO, are often accused of being epiphenomenal to the current power distribution and essentially fallen prey to the influence of its member states. And so, although the WHO's mission is often posited as being apolitical, health is inherently a political issue, thereby consistently forcing the WHO to juggle between political and epidemiological considerations. So even acts that might seem trivial, such as information gathering and information dissemination, entail an implicit recognition of borders, for instance, accused of attempting not to the stream of financing. And following the outbreak of COVID-19, the organization has been strongly criticized for its alleged lack of leadership, while being accused of defending Chinese interests to the detriment of global ones. But I mean, it is important to note that member states' assessed contribution to the WHO make up less than 13% of the organization's budget, meaning voluntary contributions constitute the main source of funding. And these voluntary contributions, often donated either by state or non-state actors, are donated for specific programs, which are often obviously aligned with their own priorities. And they can also choose to pull the plug or threaten to pull the plug under certain circumstances. So all of these sort of various constraints do constrain the WHO's ability to effectively conduct its mission. Although we know that there is no direct necessary correlation between funding and influence over the WHO, we still view a certain dependence on states' financial capital, but also on states' informational capital. But at the same time, we've also noticed that the WHO has done a lot in order to help promote global access to vaccines, for instance, through the COVAX facility, which has, within the sort of 6 weeks, it has started to roll out supplies. It has managed to deliver nearly 38 million doses to over 102 countries across all continents, which is substantial and a very important progress to note. But still, what could be done within this regard is, first of all, more political and financial attention, not just to COVID-19, but to health in general. Health has often been viewed as a low political issue, but we're sort of hoping that after the pandemic, it will be viewed rightfully so as a more high level and even security issue that threatens populations and has a real hold on countries' potential and growth. So more public, political and financial attention to communicable or not is time immemorial, and at the same time, less dependence on member states.
Or to redirect their expenditures. Of course, during the crisis, many countries took some situation of exceptionality to redirect some of their expenditures to focus on health and to address some of the issues that the needed population had. Of course, after the pandemic, this is going, life is hopefully for governments are going to back to normal, but with stronger financial constraints. So when we that's important, because when we look, and then I'm coming back to the chapter at all different geographical divides that were mentioned, rural, urban, or by city size, we see that there are different ways in which these different geographical spaces were hit by the pandemic. I have some a table from my chapter, just a couple of facts here. So let's take the example of Santiago metropolitan region in Chile. When you look at the mortality rates in the poorest counties that reached over 5 times those in the richest counties or areas of the metropolitan region of Santiago. In Sao Paulo, where I live, the poor households, which tend to be on the outskirts of the metropolitan fringe, the periphery, presented a much higher excess mortality rate. Why I'm bringing these facts here? Because even in large urban agglomerations, which are more densely populated, and of course they were more affected by the pandemic. We have within inequality. So you have areas in the urban areas that have better access to health, to education, to water, to all the infrastructure, and they can cope better with the pandemic, and those that are more vulnerable. So there is this issue that's important, but there is another issue, and I'll come to this so that we can make a link with the debate about education, right? Which has to do with the rural-urban divide, okay? When we look at some of the mitigation strategies, right, that were put at the table, they also had to face with the challenge to deal with spatial inequalities, especially the global south. For instance, a large number of mitigation proposals relied on the use of mobile phones, right, those that we have. So most of the tracing strategies require residents to be contacted by cellular phones. In many countries where schools closed, and in Brazil, many areas schools are still closed, governments implemented different distance learning IT strategies to mitigate the adverse effects on education. But when you look at the regional differences across the country, there are kids without access to a proper device, and actually there are kids that live in regions with poor connectivity infrastructure, right? So at the end of the day, this is going, I mean, the effectiveness of the mitigation strategies will have also different impacts in rural and urban areas. So I'm here, I'm in Brazil, 4 hours from Sao Paulo. I'm in the mountains, actually a richer area. I'm lucky because I have visual contact with the mobile antenna. I have to spend resources to get a proper connection, but 1 kilometer across the mountain here, there is a village full of kids that don't have access to the internet, right? And you're talking about a very rich area of Brazil. When you go to the poorest area, situation gets even worse, right? And talking about Morocco, I refer you to a very nice study by colleagues from the Université Mohammed VI Polytechnique, looking at the spatial dimension of poverty in Morocco. Look at the provinces, and you see, right, a complete different map of needs, right, when you compare different regions of Morocco. So if you go to Oriental, you see that usually poverty is more associated with the lack of access to infrastructure such as electricity and housing. When you go to the urban areas such as Casablanca and the surrounding area, you see that the type of poverty that occurs is more related to the access to the labor market. So you have to provide education and proper training so that people get inserted in the labor market. So it's very interesting in a way to try to look at these different geographies to see that there is actually, we cannot talk about winners during this pandemic. Every single region within a country has something to suffer about what's going on in the world. And of course, that's bring additional challenge for governments to cope with these regional inequalities and how regions are affected in different ways by the pandemic.
Thank you, Haddad, for your responses. The only last part that I may not agree with you is the fact that there were no winners. I think the magazine Forbes said that some maybe 1% of the billionaires of the world made a skyrocketing profits because of this pandemic. But that's another story. Let me open the opportunity to see Mustafa, if he's still with us.
Thank you, Ambassador. Maybe I would like to share two points. The last one mentioned by our colleague Haddad, which has to do with the gap, regional or geographical gap that can be identified by the pandemic. This is, I guess, true in our region, not only in Morocco. And I guess that the global health index is quite clear on that. So if you take Morocco in terms of quality of medical services, it is highly benchmarked. But in terms of the national distribution, we have found that we have a lot of things to do, because we have found that quality of services is related to hospital, universities, and we have only few. So this is a very important lesson to learn, maybe, and for the public policy, the policy makers in Morocco, maybe they should look at this issue. The second issue, which it's not my area of expertise, but as a citizen, I am quite concerned about the governing body in WHO. I guess that we have seen how, well, despite of all the efforts done by the World Health Organization, if we take the Gavi initiative, we found that they were not able to make concession over platform to support countries to have vaccines. We found that, as mentioned in a very diplomatic way by His Excellency Mr. Loulichki, that there is a lot of actors who are trying to take benefit financial and economic benefits from the crisis, unfortunately. So many institutions, they are trying to turn billionaires because of this pandemic situation. And here, I guess, maybe the World Health Organization and the governing bodies should look at this issue to fix it, because in the constitution of the organization, the technical committees, sometimes they are much more related to state members more than to the organization itself. Thank you.
Thank you, Mustafa. Well, we still have 10 minutes, and I have received 3 additional questions. I will share them with you, but I will ask you to give a very concise and be as brief as possible. I think these are extremely as important as the first one. The first one, it's like a statement. Discontent raised the issue of decentralization of the process of decision in public policies. I think this is referring to some controversy that happened not only in developing countries but even in developed countries about associating the local authorities to taking decision to strategizing and to implementing. So that's the first one. The second one is about these category of the population that is not national and not regular residents, i.e. the migrants, and regardless of the status, if they have been included in this, if they have benefited also from the vaccination. And I think that as far as this country is concerned, I think some of these population has been included. The third question is about research and development that is lacking in the global south, and the financial means, because, for example, countries like Kazakhstan, countries like Nigeria, like Turkey, managed to be able to produce vaccine, but they didn't have the infrastructure, they didn't have the financial means to pursue the production. And the last, and I think but not the least, question is about why regional dynamics, even in the European Union, did not work in addressing this COVID-19. So too many important questions and so little time left to address them, but I have full confidence in the 3 of you to give a very short and very direct and concise answers. And I will begin by Mr. Eduardo Amaral. Please, go ahead.
Okay, so very briefly, I think, of course, the issue of decentralization has also to do with the last question of regional dynamics, right? And again, I'll take my country where the all the actions were actually decentralized. Governors were responsible, and local authorities to define the strategy, but without a central coordination. So it's never going to be successful if you don't have a central coordination that will give you the guidelines. So that's mainly what's happening, what happened in Brazil, right? So, and just a brief comment about the winners. Of course, if we look from a pure economic point of view, we find winners. But from a geographical perspective, and you look, the role of public policies is not about private benefits, right? You have to look at from the social benefits and costs. And it's going to be hard to find winners in this situation. Okay, I stop here.
Okay, thank you, Eduardo. I give the floor to Salma, and then see Mustafa will have the last word.
Many thanks, Ambassador. So very briefly, I would like to rapidly respond to the question on refugees and migrants as well, and the lack of their full integration in vaccination campaigns across several countries. And this is a problematic that has truly been present for the last decades, even as we've seen that refugees are a very vulnerable population, the health of which is often not protected. Refugee camps are often vectors for the spread of various communicable diseases. And so they're a vulnerable population that truly needs to be protected and accounted for. And the issue with not vaccinating refugees and migrants is that you have a sustained community transmission still ongoing within refugee camps or within sort of the urban settings in which communities can live, and they might develop more resistant forms of the vaccine of the disease, more aggressive viral strains. And so this sort of adds to the more ethical and obviously humane argument of the necessity of vaccinating refugees as part of a global moral responsibility. And it's not just refugees that are concerned, it's also people living in conflict zones, which have been deprived of not only protective equipment at the beginning of the pandemic, but also now of vaccines, and which are undergoing tremendous compounded humanitarian crisis, and for which immediate attention should be given. Thank you.
Mustafa.
Thank you. I guess just concerning this issue of refugees and migrants, there is 5 indicators that highlight that they were negatively affected. Of course, besides what Selma said, that they are, of course, a vulnerable community, they are also basically young population. This is the most identified expanding criteria. And so they are not in the top list to have vaccines. Their economic activities, basically, they are all over the world. It's in the area of entertainment, which is locked down with the confinement and the severe procedure by all countries. And also they are less equipped by documents to preserve their human mobility. So all those elements increase the difficulties that this community is facing all over the world. And I guess the international community is doing less by these nationalistic tendencies that we are facing during the last 24 months. So I guess that it's a serious issue, it's a humanitarian issue. Of course, I guess in this country, in my country, Morocco, I guess there was quite positive signals to serve this population, but I guess we need more and more to provide such concern. The second issue, and I will close briefly, when we talk about health, I wish that it's time to include mental health, because we have found that today, I mean, mental health issue was not that much taken into consideration, despite of the fact that the cost of mental health is not reduced in the period of the crisis. Today, within the burnout, there is a very funny, and I will close with this, in China and Japan, when they calculated the burnout, they calculated in terms of a number of hours. So if I am paying someone on the basis of 8 hours per day and he is suffering the burnout, it means that I am paying 8 hours for 2 effective hours of work. So when we take care about healthcare, we are serving economy. It's not a luxury. Thank you.
Thank you, Mustafa. And I would like, on behalf of the Policy Center of the New South, to thank all of you, Eduardo, Mustafa, and Selma, for contributing to this webinar. I also address my thanks to the audience that have contributed with their questions. And I hope that they will stay tuned with us, because more chapters will be presented in the upcoming days and weeks as far as this issue 2020 of Atlantic current is concerned. So thank you and keep safe. Bye-bye.